Psychology film project A Beautiful Mind by Grace Peters. A Beautiful Mind is a movie based on the life of the famous schizophrenic mathematician John Nash. The movie takes place in the mid-1900s as John arrives to Princeton as a grad student. John Nash is a genius but lacks social skills and communicative competence. Schizophrenia is a mental disorder where people interpret reality abnormally. The common symptoms include hallucinations, delusions, and disordered thinking and behavior. John is subdued into a psychiatric hospital. At the psychiatric hospital is where the audience realizes John has been experiencing hallucinations. At the hospital, they are able to diagnose John with schizophrenia. In less medically developed countries, schizophrenia is often mistaken for witchcraft or magical persecution. In the past, people with schizophrenia were often seen as threats who could not control their violent tendencies, leading them to be put in institutions isolated from society. John displays multiple hallucinations and delusions. For example, his best friend Charles is a hallucination, as he only existed in John's mind. John also displays delusions that the Russians are out to get him, which is known as persecution delusions. The symptom John portrays the least amount is movement disorders. He's not always as jumpy. To treat John, I would prescribe an antipsychotic medication and cognitive behavioral therapy. I would prescribe antipsychotic medication to treat the hallucinations and delusions, and then I would encourage cognitive behavioral therapy to help with their depression and anxiety. The 1950s marked the start of antipsychotic medications, so they would not be as readily accessible as they would be today. In the past, people would resort to institutions for patients with schizophrenia. I believe A Beautiful Mind accurately portrays schizophrenia because it demonstrates how the mental disorder affects a person's personality, their relationships, and common symptoms such as delusions and hallucinations. While patients do experience visual hallucinations like John in the movie, they are less likely than other types of hallucinations. This movie allows for a better understanding of schizophrenia as the audience sees how it is difficult to control, but people with it are also capable of leading a normal life. It suggests with enough patience and devotion, patients with schizophrenia can be taken care of and live a normal life with the right treatment and caution.